on there either. It's a question dealing with healthcare. When Amador County turned management of its county hospital over to Sutter in 1990, it was supposed to improve healthcare in Amador County. While in some regards it certainly has, in other aspects it certainly hasn't. We are currently experiencing a severe shortage of healthcare options in Amador County, especially with regard to primary care physicians and available health plans. Even Sutter's own health plan, Sutter Health Plus, excludes Amador County from its coverage area. What can be done to address our local healthcare shortage?
Thank you. So listen, we pay, my husband and I pay $3,000 a month, $2,987.64 a month for healthcare, and we can't find doctors in Amador County. So this question hits close to home for me. Our doctor's retired, and we use urgent cares as primary care physicians, so there's clearly a problem. I think part of the problem is attracting young doctors to our community, and I know that Sutter Amador is working on that. They have a residency program that will actually start this June, bringing initially 2 and eventually 6 new residents to Amador County. These are young doctors that are part of a 2-year program here in our community. The onus is now on us to keep them here. So I think that a lot of what we will talk about today, affordable housing, building a vibrant community, recreation, a lot of those things that will attract young doctors here are important, and they're important for various reasons, including how we actually get some better health care here. Thank you.
Yes, so I think that we also need to consider how this relates to the state issue of Medicare for All. I have been active in the Medicare for All movement for about 5 years, and I think eventually we need to move to this model because it's almost nearly impossible, and I'm sure Brian could speak to this, for the public entity to have any real governance power over the private entities. And we're all facing the rising cost of prescription drugs, the rising cost of the actual premiums. We're paying for health insurance, we're not paying for health care. And so as we move to that model, I think that it would behoove the county to create some sort of public-private partnership. And I see a lot of other counties doing this. If we can bring all the partners to the table, we can look at healthcare as something that involves everyone, not just a consumer model, because there are a lot of people who are denied healthcare in this county. We have a 2-tier system, and a lot of people on Medi-Cal. Almost 44% of our families in Amador County are below the poverty line. And so we need to think about them when we're talking about community development and our community choices. So what I would like to see is a public-private partnership where we bring behavioral health to the table, mental health, and Sutter to the table so that we can begin to envision what we would like healthcare to look like as a community and figure out what each partner can bring to the table in terms of funding, and reach out to the state to see what public financing we can receive to really develop that, because as we know, behavioral health is a really big issue. We have mental health problems with our homeless people, and we also have a lot of problems with drug addiction in Amador County. That's not something that people are really talking about, but it's a hidden social ill, and I believe that it is a health issue. Thank you.
So this is a tough question to answer. It's definitely a problem, and it hits home with me also. The mic is on. Did you turn it off?
You just got to get closer.
Okay. I've had to reach out. You know, our primary doctor is now moved on and retired. We use the urgent care mostly for our family, and it's definitely something I would like to tap into and do some more research. And I agree with Amy Champlin that sometimes we need to reach out to our state to help our smaller communities to get more benefits in our primary care and everything for our community at our local. Thank you.
Yeah, healthcare has been a challenge for a lot of years everywhere. One thing I will say is for a number of years, I think Sutter Amador, it seems like it's kind of ramped up a little more. They've not been worked too well with private practitioners and allowing them to have hospital privileges. And I think that's been probably a bad thing in our community. and I haven't seen a good way to approach it from a political level. I think maybe as a community, we might be able to put pressure on Sutter Amador and say, why don't you make it easier for doctors to have privileges at your hospital? Also, America is, our nation's built on freedom and basically on dreams. And I think when you have a need, American people historically provide for that. They'll provide for that need. Businesses will start, people will come in. I don't see how, I can see government helping cure the problem. I don't see socialized medicine being answers to that problem. And that's kind of what I heard here tonight a little bit. Yeah, it is an issue. I'm more than willing to work on it. Thank you.